तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मामृतं गमय।
ॐ शान्ति शान्ति शान्तिः।
असतो मा सद्गमय तमसो मा ज्योतिर्गमय
Namaste, everyone. Welcome to our Health Week organized by Scholars Rosary Family. I hope everybody is staying home safe with their family and are really taking self care as their priority in their everyday routine. I have been teaching in Scholars Rosary for classes 3 to 10, teaching kids to really pay attention to self care and giving this a priority, like how we do brushing our teeth, like how we would take good care of our health in daily basis. So we teach children to be responsible of their own health. And that's why we have seen a lot of kids these days. Most kids have been very attached to devices. So taking this time for Health Week is again a chance for everybody of us, every one of us, especially teachers, especially our students and our parents, to reconnect back to our health. So since this epidemic has started, the lockdown has started, most people are now suffering from anxiety, depression. A lot of back pains are also there. Some teachers and even students, especially parents, have been telling and messaging us in our team that they have been feeling this back pain, this a lot of tightness in their body. Some are having some depression issues. And it is really expected during this time since we are all asked to stay home. But staying home doesn't mean that we are caged inside our house and not be able to do anything. This is actually the time for us to get back to energy building, pay attention to the way we breathe, because no system in the body works alone. And looking at the way we live our lives right now, looking at us modern body, it's not very safe anymore for everyone to do a Surya Namaskar. Like for people who would come to us in we have a yoga center in Subhash Nagar here in Rohtak, and people would come and say oh, they would like to learn Surya Namaskar, and how would they start their yoga practice, and is it going to be Surya Namaskar right away and maybe eventually learn a handstand, arm balances, and all these fancy postures of yoga that require a lot of strength and flexibility right away. But for a modern yoga body, for a modern body like us, is not very accessible anymore because the way we live our lives these days, we have compressed our spine. We have lost connection with our muscles. We are not as strong as our ancestors who used to climb trees to get that mango. Now we just stay home, wait for the mangoes to arrive, wait for these fruits to arrive. And children right now just open the fridge and there it is. So our ancestors used to climb, used to run, used to leap, used to carry heavy objects. And that's why their practice of yoga was made to relax them. It was made to re energize them because of the heavy load that they do every day. But for us modern people who are, especially the city people, we are always stuck in our chairs, slouched like this all day. Maybe you have seen your children, parents right now. Welcome to our Health Week. So you must have seen a lot of your kids who are sitting like this all day. No, like we have online classes and they must have been sitting like this. And we can't blame them if we again and again tell them to please sit up straight, sit up straight. This is not the way to learn. Well, if you look at it, children these days are not as active as how our daddies, our nannies, and our dadas used to be when they were kids. So right now, the kids are not very in touch with their primal strength that even as simple as sitting straight, we're not able to support our spine anymore because the muscles, our core muscles, our postural muscles have weakened over time because we have lost our crawling. We don't crawl anymore. Kids don't play outside anymore. Kids would, whenever they have a free time, they would always go to a device. They would always switch on the TV, and there is no self-care. So what we teach for our children in Scholars Rosary is that be very responsible and do your self-care as early as now, as early as the SKG students that we have, so that we grow up, our next generations will evolve into a much stronger human beings. So right now, I think a lot of our teachers also, a lot of our parents are having back pains, a lot of tension in the shoulders, even as simple as, reaching the hands high up or maybe sitting down up and down the chair, the knees are already starting to pain. So these pains are already our bodies telling us that there is something wrong that we are doing. Okay, so these are your bodies calling that, hello, it is now time to change some patterns with maybe the way you breathe, the way you move, and the way you sit. Sitting is not actually injurious for everybody. But right now, sitting has become a very destructive thing to do because not everyone would sit straight. Some people who would sit straight for a long period of time are able to support a very tall posture. But how many of us here, viewers, can sustain this posture, breathe properly as you do your desk job? How many of us can sustain this without any pain? Okay, so we will recognize this pain as our body telling us that there is something wrong that we are doing in our lifestyle and must be changed right away. So, what I am going to teach everybody right now, if there's something I would teach to anyone in a limited period of time, is for everybody to learn how to decompress the spine. Sitting for a very long period of time makes you compress your spine again and again. And if you notice, our spine just doesn't start from the shoulders. Our spine starts from the very base of our skull all the way down to our tailbone. So that's a very long, beautiful, strong structure in our body that we must strengthen. But the way we're sitting, we keep pounding into our vertebrae, and there's no good flow of energy, good blood flow that is happening and going on inside of us. We are obstructing blood circulation because we are not moving. Humans are made to move, as what we have discussed yesterday in our yoga day. Humans are built to move and lift and carry heavy objects, but we're not doing it right now. And that's why we will need some yoga therapy. Now we will need to reconnect to our inner strength. Now we will need to pay attention. How am I sitting right now? Because our core postures, our postural muscles, our core strength, our breathing muscles are all the same. Okay, so let us look at our bodies right now as a basin of energy. This is an energy canister, which we will need to keep filling up. And for us to be able to fill this up, we will need to be able to breathe deep into the abdomen. Now, what happens when you are in pain? What happens when you are stressed? What happens when you have not gotten enough sleep and have been negligent with your self-care? Is your stomachs tighten. Our stomachs tighten, and when our stomachs tighten, what happens is when you take an inhale, the breathing just settles shallow right on the chest. But instead, it should go deep into the abdomen. So what we're going to do right now is take out your 10 fingers. Hopefully you've been washing your hands also. Pay attention to the last part of your ribs. And I will need everybody to please lengthen away the ribs up and away from your hips. Okay? So with your hands, find the last rib and pull it up and away from the hips. Open up your chest. Lengthen the ribs up. So right now, how many of us are sitting slumped down? Okay, so looking at our bodies as an energy canister, we are going to make space in this box of energy. Okay, so can we all do this? Even our daddies and nannies, people who are in pain, please join us also, because this is going to be very helpful with managing your pain. Just by learning how to decompress your spine, by doing all these 11 spinal movements that we're going to do today, it is already going to give a lot of relief from all your pains. And you know how sometimes we feel heaviness in our shoulders, some tight neck, and when there's a lot of obstruction and tightness here, what happens is that the blood flow doesn't go all the way up towards our brain, and our brain would again signal that, okay, you are not getting enough oxygenation to the brain. You are going to have some migraine. You're going to have some headache, because your body is not functioning as optimum as it should be, because we have lost contact to our breathing muscles, our postural muscles. Okay, So let us help our bodies breathe deep, breathe naturally, and flowy, smoothly into the abdomen. But we're not going to be able to do that until we make some space here and allow the inhale to flow in. Okay, so lift the last part of your ribs up and away from your hips and notice how your breathing changes. Relax your stomach, soften your stomach as you sit tall. So if you have any of us here who have some knee problems and can't sustain standing for too long, you can do all of these hasta vinyasa, our spinal movements today, by sitting. And for those young people who have been sitting all day already, your yoga would be done with standing. All of us would be standing on our feet, power stance. So before we start our movements, we make sure that our hips are stable. Imagine your pelvis like the basin of water, and you're not going to let the water fall forward. So stabilize your hips as you lift the ribs up and away from your hips. And as we stand tall here, every inhale, think as if you are drawing energy from the ground through your feet all the way up towards your head. And if you notice those aunties that are walking through the farms, carrying heavy objects on top of their heads, carrying baskets of fruits on top of your head, you will never see them slouching. Okay, they're all very tall, very good, strong core muscles. Okay, so from here, think as if you're carrying maybe a few books on top of your head, constantly pushing the crown of your head up while your feet firmly connect down to the ground as you stand. So what we're going to do is we're not going to slouch down.
Sorry to interrupt you.
Relax your shoulders back.
Sorry to
Anji.
interrupt, ma'am. Can you be little louder as your voice is very slow?
Okay.
Be little
Grandma.
louder, please.
Okay. So is it better now?
Yeah, little better.
Okay. So what we're going to do is again, stand tall with your feet just hip distance apart. Stand tall, proud chest, spine long, neck long, arms relaxed out to the side, no pressure on the knees, no tension on the lower back. Pull the base of your skull up and away from your shoulders as you stand. Now from here, on our inhale, we will raise the hands out to the side, just at the shoulder level. And think as if both of your hands are pulling you to the side. So if there's two groups of kids playing on each side, tug of war, try to really stand your ground and own your space. Okay? So here, reaching out to the left, reaching out to the right, create some space, some sense of space, some sense of length, so that we're able to let the air flow in naturally and smoothly. Take a full breath, inhale. Long exhale in 5, 4, 3, 2, and 1. And as we press our palms down, imagine as if you're assisting the breath to slowly press down and away from your lungs. Let the breath come in, inhale, reach out to the side, shoulder level. Exhale, 5, 4, 3, 2, and 1. One more time. This is just to reconnect us to how nice it is to breathe slow. Inhale. And then on the exhale, 5, 4, slowly let the breath go. 3, 2, and 1. Again, no tension on the knees as we stand. Now from here, inhale, we raise the hands up. Interlock your fingers. Turn your palms facing up. And then lift and push a heavy object on top of your palms. So again, we imagine that we're pushing a heavy object on top of our palms, and notice how your shoulders would press down and away from your ears. So common mistake that people would do here is that on the inhale, the neck tightens and it creates more tension around this area. And again, blocking blood flow towards the full body, okay? So what we're gonna do is, as we reach up, imagine you're pressing heavy objects on top of your palms. Inhale, lift, the neck stays long, the sides of the waist remains long. And then exhale, release arms out to the side. One more time. Inhale, reach up. Keeping your palms turned up, pushing up towards the ceiling. We are going to exhale and pull the hands to the back of the head. And as we pull the hands back, keep the back of the neck long. It's not going to squeeze in. Your trap muscles, your upper back muscles are not supposed to squeeze into your spine and further creating the compression. Remember, we're doing this spinal movements to release tension from the spine. And then exhale, release. Slowly. Inhale, third movement. Inhale, extend. Raise both the hands up. And then on the exhale, turn your palms facing back. Grab onto your shoulders. Inhale here through the openness of your chest and your side ribs. Feel your breath pushing out to the sides. Inhale, lift both hands back up. Exhale, release. Inhale, reset first, keeping your breathing, your abdomen very soft, so your inhale comes in softly. And then exhale, relax. Soften your skin, soften the facial skin, and imagine as if your bones are just floating inside of your body. Fourth movement, inhale, raise both the hands high up. And then on the exhale, we will cross the arms, grab onto the shoulders. Inhale fully into the abdomen. Long exhale, the belly pulls inwards. Inhale, raise both the hands high up. Exhale, we slowly pull the arms out to the side. The shoulders will also pull back and down towards the hips. Inhale, raise both the hands up. So if earlier you did with the right hand in front, now we're going to cross the left hand right in front and then grab onto the shoulders from the back. So my arms are crossed as I pull down my shoulders and reach for my shoulders with my hands. Inhale fully here. Exhale, soften your shoulders, especially the upper back. Inhale to turn the palms up and reach. Exhale to slowly release the arms back down to the hips. Okay, so the first arm movement was inhale, we turn the palms up. Exhale. Our second movement was to bring the hands to the back of the head, palms reaching high. Exhale to pull the hands to the back of the head. Inhale, lift. Exhale. Our third movement is from here, we'll reach the hands forward. Exhale, we turn the palms facing back, grab onto the shoulders. Inhale to lift the hands back up. Check on your neck if the length is still there. Pull the shoulders down if you feel your shoulders are pulling high up towards your ears. And then exhale, pull your arms forward and down again. Next movement, inhale, reach both the hands high up, keeping the neck long, push the palms reaching up. Exhale, this is the fourth movement where we cross the arms and grab onto the shoulders. Inhale, part of your fourth hand movement. Same. Cross with the other hand in the front this time. Inhale to lift. Every time we reach the hands high, we inhale here. And then exhale. Slowly release the arms back down. Inhale, raise both the hands up. Going now to our fifth movement. Inhale. On the exhale, we reach the hands forward. right in front of our shoulder level. Now imagine here, it's not going to be a sloppy movement where we just bring the hands down. Energy comes from mindfully moving and breathing your hands and paying attention to how you are breathing and how you are doing and executing the movement. This is how you create energy and decompress your full body. On the inhale, imagine as if you're scooping ghee with your bare hands. And then inhale, open up the hands to the side, expanding the chest. On the exhale, turn back of the hands, pushing in towards the front. Inhale to lift both the hands up. This time on the exhale, squeeze your glutes, squeeze your hips, and then rotate your shoulders fully. Inhale, raise both the hands forward. Exhale, release the hands back out to the side. Coming back up, inhale, reach the hands high up. And then exhale, hands back out to the side, back to our samastiti, our equal standing. Okay, so I hope everybody was able to execute it. And while we are doing this Hasta Vinyasa, a lot of students would usually say they were very challenged with the way they're breathing. This is the movement. What we're doing right now, the Hasta Vinyasas, is more also like an assessment to do a self-checkup right now. Because doing your Hasta Vinyasas will reveal a lot of things. Number one, are you able to move your joints, your shoulder joints? Your shoulder joints are a ball and socket joints, okay? So it should be able to rotate up and do these movements with a very good range of motion. But then again, with our desk job and a very poor posture the whole day, our shoulder is just like stuck there. And all the muscles surrounding our joints, all the muscles surrounding our spine has got weak because we never lift heavy objects anymore. We never do anything anymore. Our primal movements that make us a strong human being and superior being on this planet. So we're not doing those things anymore, and that's why our health is also depreciating. Okay, so doing this Hasta Vinyasas will also show, okay, I was not able to do a full shoulder rotation there because a human being is supposed to be able to do a full shoulder rotation. A normal human being is supposed to be able to do a back bend, touch your toes, balance on one leg, maybe create an extension, do a back bend, hinge, squat, invert themselves. Okay, so there is freedom. When we talk about who is a healthy person is a person who is not stressed, or maybe they're stressed because we can't avoid stress, is able to ride on with the stress without being easily angered, without, going out of control with their breathing. The healthy person stays calm. The healthy person gets the job done. And the healthy person, most especially, is not going to stand like a sick person. Because if you look at the hospitals right now, sick people are shallow breathing. So I was a nurse before I became a yoga teacher, and I would always see and check when we assess very sick people, they are very shallow breathers. Number one. Number two, they are mouth breathers. So we are always running in our fight and flight response. So every human being has two systems. We have fight and flight response controlled by our sympathetic nervous system, and we have our parasympathetic nervous system, which is our rest and digest. So what happens is most of the people right now is running through fight and flight. We are always stressed. And the physical effect of that stress is your body will release cortisol, stress hormones. And that's why there's more acidity in your pH. You're more acidic. Your pH balance is not there. You are also always, breathing shallow and are experiencing a lot of pain. Okay. So what we want to do here is to reconnect to the breath. And that's why we're doing these spinal movements to again bring back vitality in our spine and the way our body moves. So right now, as we do our Hasta Vinyasas, those people who have been suffering from back pain, you may sit on the chair if it's not very comfortable for you to stay standing. My scholars, rosary students who have been practicing yoga with me and are very strong right now, especially the ones who are now in classes 8 to 12, you can do this whole Hasta Vinyasa movements in your lunging position, okay? So number one, the people who are not feeling very strong, as you do the Hasta Vinyasas, all those 5 movements that we have just done, you can sit on the chair, take your back off of your support of the chair, lift up and align your head, your ears, your shoulders, your ribs, and your hips. Those 5 points all at the same line. So these are the things that we can easily add in our daily routine that, oh, I am going to work right now for 4 hours, but I gotta make sure, check every 20 seconds, every 20 minutes that, okay, I am now moving away from my spine and moving closer to my device. What can we do? Okay, we're going to go back to our power stance, which is realigning the head back on top of the shoulders, realigning the shoulders right back onto the hips, and our ribs right back onto our ribs right back on top of our hips. And by doing this, you're already helping yourself so much with the way you breathe, with the way your energy moves inside the body. Okay? So when you're starting feeling the back pain, oh, I am already leaning forward. So recheck, reassess yourself, reset your form, and it's going to be a very beneficial thing to do. If you don't have 1 hour to do your yoga practice, then at least pay attention to your posture every time you do long hours of sitting jobs, okay? Number 2, from here, move your shoulders using our Hasta Vinyasas. So again, for those people who are not very comfortable with standing, you can do it seated. People who are able to, who have been sitting down all day, please do it standing up. People who have been very active during this whole lockdown, please do it in a lunge. So here you can follow me here. I have first shown you how to do it standing and then seated. Now I'm going to show you how we do it with a lunge, okay? So from here, standing with your feet hip distance apart, shoulders relax down. Inhale, raise both the hands up. Let's do it together, okay? And remember that we are constantly drawing energy from the ground up through our feet. Inhale, reach both the hands high. Push a heavy object up and away from the head. Exhale, hands to the hips. And then move your hips back. Okay, so what I'm going to do here is I'm not going to bend from my spine to lean forward. Okay, so many people would do this, like touch your toes. And then the toes are so far from the feet. Okay, so make sure that you are hinging from the hips, keeping your spine tall as you reach down. Okay, so now the chest is now parallel to the ground. What we're going to do here is we're going to step the left leg back and carry your spine back up into a Santulasan position, a lunge. Our ancestors used to push very heavy objects. Our ancestors used to pull very heavy objects. And that's why their glutes were very well developed. They're naturally, structurally strong. That even if a bull maybe would run onto them, they're not going to get this balance, okay? And that's why we are doing a lunge to own your space and really make your structure strong. And maybe when you do all of these postures and movements, by the time you sit down on your chair for 3 hours, you are not going to drain your energy because you have lost your posture. This will prime your spine. This will prime your system to do your long hours of work while maintaining a very good form, a very good breathing. So here, everybody, the stronger people, younger people especially, sit on your lunge, okay? So here, the right leg is forward, the left leg is back. Create a very strong lunge as if you are tearing your yoga mat apart with both of your feet, okay? align your head, shoulders, and hips on top of each other. So we're not here. Okay? Healthy, strong people, here. Open chest. Stand tall like a warrior. Okay, so from here, inhale, same hand movements. Raise both the hands up. Inhale and feel your breath go deep down into the abdomen, decompressing the spine as you do this, create length. And then exhale, pull the hands to the back of the head. Second hand movement. Inhale, extend both the hands high up. Exhale, turn your palms facing back, grab onto the shoulders. Okay, I'm going to show you how it looks from the front. Inhale again, push a heavy object up on top of your palms. Exhale, what's the next movement? Anybody remembers? We're going to cross the arms. So my left hand is in front right now as I grab the shoulders from behind. Inhale to extend both the hands up. The shoulders are not going to go up with you, okay? Exhale, the right arm goes in front of the left. Grab onto the shoulders. Inhale, extend both the hands high up. And then exhale, rotate, shoulders reaching back. Inhale, reach both the hands forward and lift the hands up. Take a full breath here. Inhale. And then exhale, lean to the front. Keep your hips wherever it is. The hips are going to stay there as I grab my hips with my hands, keeping your chest open and step back to the front. Okay, so we are in a hinge. Scholar students know this. One of the 7 primal movements of a human body. We are able to hinge. Okay, the right leg back this time and then come back up. Unload your spine. What we don't want to do here is to drop the pelvis again. Okay, you must see very beautiful yoga postures on Google right now, like this. Okay, we're not going to do that. Again, if your back is already compressed, you are creating more compression by doing this. Okay, stabilize the pelvis. Re-engage the core. Stand tall. This is not stable. This is strong. So do the one that re-engages your postural muscles, which are also luckily our breathing muscles. Okay, so from here, keep the ribs lifted, legs strong, chest open, brave posture. Inhale, raise both the hands high up. So the hands will keep moving, the spine will remain stable, and your legs maintain that structure as we do it. Ready for our Hasta Vinyasa. Inhale, reach high. Second movement, we exhale and pull the hands to the back of the head. We inhale here and push the hands high up. Exhale, okay, reset. Inhale, we raise both the hands forward as if you're vacuuming energy from the ground up, all the way up towards the ceiling. Exhale, turn your palms facing back. Grab onto the shoulders. Inhale, extend, raise both hands up. Exhale, hands forward and down. Third movement, inhale. Going on to the fourth movement, we're going to crisscross the arms. Exhale. And as we do it, students, don't lose your structure. Keep the back leg engaged. Inhale, extend. Exhale, lunge tall. Other side of the hand now in front. Inhale, lift both the hands high up. And then exhale, hands forward. Press. Inhale, turn your palms open. Lift the chest up. Exhale, reach the hands forward, keeping the neck tall. Inhale, lift, last hand movement. Exhale, full shoulder rotation, going up to your Santulasana. Lift, inhale. Now, as you hold this posture, everybody who is in the lunge position right now, this is your lunge. Imagine as if there's a few kids running around and trying to destabilize you. By imagining that somebody is trying to destabilize you, notice how your core muscles will naturally engage, because that's our body's natural mechanism to protect you from falling. So by imagining that somebody is trying to destabilize you, you are engaging your core and postural muscles so that you don't get destabilized, okay? So remain strong here. Inhale fully. Exhale, hands back to your hips. Lean to the front, keep your hips steady there. And then we step back to the front. Notice how we keep our spine tall here. We're not going to lose connection and compression to our abdomen. Reaching the hands like this, see, it disengages my core muscles, which are your abdominal muscles, okay? So here, I'm gonna hinge and keep my back flat as I bend forward, okay? So whenever you pick up a heavy object from the floor, maybe a child who is having a tantrum, they really make themselves heavy and then they don't wanna get up, okay? So what parents would do is, parents usually pick their kids up like this or pick the groceries up like this. Please protect yourself. Please protect your back. This is not the time to get sick and get injured right now. So if whenever you feel like, okay, you need to lift a very heavy object right now, hinge properly. Keep your spine straight. Send your hips back and then pick up that object. Even if it's just a pencil that has fallen down on the floor, pick it up properly using a very good body mechanics. Okay, make your muscles work. Make your bigger, stronger muscles of the legs work on lifting a heavy object. Not your spine, please. There are very small muscles that are protecting around the spine. So make sure to use the right muscles and then lift your spine back up with while maintaining length, while maintaining compression of the core muscles. Standing back up, inhale, raise both hands high, push both hands high up, and then exhale, place your right hand to your chest, check your heart rate, press your left hand to your abdomen, see if you're still breathing through your abdomen. So our first session of in our health week right now is to check right now. We're not going to be able to do all this very comfortably first. So you might notice right now your range of motion maybe is not comfortable. It's still limited because of the way we do our jobs daily. So by doing all of this practices, it's going to start opening your shoulder joints. It's going to start decompressing the spine by regular practice. So when students ask like, what asana is good for the lower back? What asana is good for this one? It's not about the asana. So like what our chief guest yesterday said, it's a whole practice. It's not just the asana. The asana is just a very tiny part of our yoga system. It all starts from your yam. How good are you self-negligent right now? How well are you taking good care of yourself? Okay, so just like you're brushing teeth, okay, everybody's brushing teeth, good. Everybody's taking a bath, good. Everybody's brushing their hair, good. Trimming their nails. But how many of us make sure that I am getting 8 hours of sleep every day? How many of us here are making sure that, okay, I'm going to sit tall so that I don't keep compressing my spine and block the blood flow? How many of us here make sure that, oh, I am drinking and hydrating myself? How many of us here notices that, oh, I have been here watching this movie for 3 hours now. I think I need to rest my eyes. How many of us here are actually, okay, I have been eating a lot of sugar and I have been having a lot of deep fried food. I think this is the time to maybe do some detox by hydrating myself and making sure I am eating a lot of fruits and vegetables every day. Okay, so if you are missing on these things, what we do right now is it's going to already show where are we going to be 5 years from now. What we do right now will show 5 years from now. So some students also would think, ma'am, I am not losing a lot of weight, but I am eating good food right now. I am making sure that I am managing my time so that I have time for exercise. I have time for yoga. I have time to do very healthy hobbies. So yeah, don't worry, beta. 5 years from now, it will show. It will show in your health. because there's two ways with our health. What you do right now will either bring you towards wellness and health, towards your right side, or what you do right now, if you're doing more bad habits than good habits, then it's gonna lead you towards disease. Which way are we going to go to? Is it going towards health and wellness, or is it going towards diseases? Okay, so I hope everybody is going to use this time to start doing healthy habits. And not because it's yoga day that, okay, we're doing yoga today. And in the next 12 months, no more yoga. Only in yoga day, we're doing yoga. Okay? So, yoga day, commit to taking good care of yourself. Commit to learning what can I do to decompress my spine? What can I do so that I can get back to my parasympathetic nervous system? Because I am always stressed. The phone just rings and then so our ancestors used to have that same reaction when there's a tiger, when they go hunting and then there's a tiger or a lion that just suddenly appeared. So it's our body's natural defense mechanism that adrenaline also rushes so that you'll be able to um, stay alive. That's your survival mode. So right now, most people are in survival mode, even when there's no real threat, even when there's no real danger. And it shows in there's a lot of physical manifestations, all this pain, all this shallow breathing, some decaying in the cells already happening inside because we're not breathing well. Cancer starts before it starts showing symptoms. Okay, so oxygenate your cell, each and every cell, oxygenate every day through the practice of yoga. Open up your body every day, make space, decompress, part of our self care. Okay, so if we would like our children to start doing self care, they don't usually listen to what we say. Children usually see and then they do. So if they see that, oh, our parents do yoga, they really make it a point that they have yoga as part of their day. Like how we make sure that we have toothbrush as part of our day. Okay? Because without toothbrush, if you imagine 10 days you don't have toothbrush, what happens to your teeth, your bones, your teeth will start to decalcify, tartar will start to come. So it's gonna be the same thing for our spine. It's our internal organs. It's just that we don't see them. That's why we don't see the direct effect of a sedentary lifestyle. That's why we don't really pay attention to it. We usually do self-neglect. But if you can see through your skin, what is happening inside when you're doing yoga? What is happening inside when you are mindfully breathing? That is your yoga. Yoga is not just your postures, you balancing on one leg, but thinking of something else. Some people would do yoga, Surya Namaskar, but thinking of, I'm gonna do this 20 more times so I could lose my weight. Okay? Do yoga because it is needed. Do yoga because you know that it's something that a modern body like what we have essentially needs to prime ourselves and get back to our rest and digest mode. That's our parasympathetic nervous system, that we are staying in our rest and digest. Even when there's a lot of stress, we are able to maintain calmness. Because when we are calm and then there's stress, we are able to think straight and make better choices compared to when you're stressed right away. Everything goes haywire. And you will notice how your breathing also changes. Okay? So fix your posture, fix the way you breathe, and really invest more time in self-care. So right now, every time you do yoga, maybe it's just 20 minutes, that is your daily self-deposit, health deposits. And the more you don't deposit anything, the more our health depreciates. Okay, so I hope everybody was able to learn something from that. We will give maybe a few tutorials on how to do spinal movements properly so you can also do it at home. So now, relax your shoulders back, stay tall. So again, you might have noticed now, no, listening to the whole session today, maybe some of us are already moving the heads forward. Again, realign the head back on top of the spine. Don't think of anything right now. Just think of relaxing the skin. Do a self-check. When I inhale, am I letting the breath into my abdomen, really relaxing the belly? Or when I inhale, do I tighten my belly? That is already a paradoxical breathing. It's not the correct way of breathing. Okay, so inhale, relax the belly. Exhale, belly pulls in. Inhale, 1, 2, 3, 4, 5. Spacious here. And then exhale, don't lose that space as you let the breath go in 3, 2, 1. Stay tall. One more time. Inhale, let the breath in. 2, 3, 4, 5. Exhale. 5, 4, 3, 2, 1. In the next 3 breathing, we're going to say Om while our mouth is closed. It's Brahmri. So inhale fully through the nose. Inhale 1, 2, 3, 4. Belly is relaxed. Exhale. Two more times. Let the breath in. Inhale. 2, 3, 4. The lungs are full. Exhale. One more time. Inhale. Relax the shoulders, soften the skin. Exhale. Now we'll slowly join our hands together. Students of Scholars Rosary, you already know what we do with our mantra. Together, let us all say, health and happiness to all for 3 times. Thinking of all our loved ones and all our frontliners, our teachers. Together, we will send prayers to the whole world. Health and happiness to all. Health and happiness to all. Health and happiness to all. We think good thoughts. We speak kind words. And we spread love, health, and wellness all around us. Namaste, everybody. And we'll see you again for next time.
Om
Good evening, everyone. It is our absolute honor and privilege to extend a hearty and formal welcome to our eminent guests to the webinar on eye care. We are gratified by the presence of our guest, Dr. Urmil Chawla and Dr. Sumit Sachdeva amongst us. Scholars Rosary family feels graced by your august presence, and it is my privilege to introduce our honorable guest, Dr. Urmil Chawla first. Dr. Urmil Chawla, Professor, Pediatric Ophthalmology, Squint and Oculoplasty Unit, PGIMS, Rohtak. She completed her MBBS and MD in Ophthalmology from Pandit Bhagwat Dayal Sharma, PGIMS, Rohtak. She completed her DNB in Ophthalmology from National Board of Secondary Education. She has 85 articles to her credit as author and co-author in state, zonal, national, and international journals of repute. Her alchemy is evident with 11 chapters written in books of national repute and international conference. Dr. Chawla's valiant success has been honored with various titles like Editor par Excellence, HOS Appreciation Award for acting as Organizing Secretary of Optha Feast in 2018, and Gold Medal for the Best E-Poster Presentation in 2017. We at Scholars Rosary feel honored by the benign presence of our eminent guest. And now I request Dr. Urmil Chawla to kindly begin with the eye care session. I request Dr. Urmil Chawla to kindly begin with the eye care session.
Hello, can you please enable me for the screen sharing? It's not showing. Yes. Yeah. Thank you. At the outset, I would like to thank respected Preeti ma'am and Ravi sir to give me this opportunity to be part of this lovely webinar. And thank you for the humble introduction. I'm humbled by it. Today, my topic is a very general topic which we all are dealing in this COVID era. I would say one thing, this COVID era is teaching us so many things, but one drastic change that it has brought in almost everyone's life is the digital screening part. Nowadays, from child to an adult, our digital screening time has enormously increased because we have time and everything is going online. So it has become the need of the hour. But like as we say, everything is moderation is good. But once it goes into excess, it brings its drawbacks with it. So today I'll be discussing with you the various positive points as well as the negative points of this digital screening. What is it problem that the children are facing, and what the parents are, how they should deal with it. So I'll start with my talk, digital screening, ocular stress and strain. So as you know, the digital screen time has massively, it has increased. There's an explosion in the digital screen time, which has been outside the school. And nowadays it has become in school, which is for the educational tool. This is an additional that has increased in this COVID era. So at the minimum that we have observed, that children out of their video time, their school learning time, their YouTube time, they are taking out at least 6 to 7 hours or rather more than this time on the spending on screen daily. Previously, we were limited only to the TVs and the PCs, but now we know you have tablets, smartphones, laptop, and the best part of them is they are easy to access as well as transport, and that makes them easy to use. Now with technology, the academic experience definitely expands, but also it brings few serious caveats with it. And so studies have shown that increased screen time leads to eye fatigue, depression, anxiety, interrupted sleep, and loss of physical fitness. And the best way to protect your child is strike a balance between screen time and real life human interaction. So the static energy, that is the energy which we are spending on the screen time, and the dynamic energy on physical activity is definitely getting decreased. So the balance is disturbed, and that is where the problem is arising. So we need to maintain a balance. Now, what are the pros of the screen time? It is a vehicle for information. We know that it is a tool for communicating with friends and family, that we are observing all Zoom meets, all friends, families, they are continuously, they are keeping in touch with each other to adopt helpful behaviors like yoga classes, health exercises. People have spent most of the COVID time in finding out healthy recipes. So all these are through this only. And then screens also encourage learning through webinars. I think conferences and webinars online are just going on and on everywhere. And so that has increased the screen time. Now coming to the cons of the screen time. It slows the language development. We can learn words using the screen, but definitely the feedback that is necessary to develop and use the language is not possible through this. It stifles the creative thinking. So the old times playing with dough, with drawing and crafting, stacking blocks, reading tangible books, that has almost gone to the back seat with this screen time coming in the front seat. So that is a big drawback which we are facing. And social skill development is definitely deteriorating. Nowadays, the children are unable to behave in socially appropriate ways. They're not ready to sit with their friends, with their families. They just want individual attention sitting on the mobile. That is all. Now come to the digital eye strain, which is the most scientific part of it. So I open a questionnaire before you, and you just think about it. Do you have any of these symptoms while you are using these digital devices? Do you have eye strain, headaches, blurred vision, difficulty in changing the focus from far to near, dryness of eyes, irritated and tired eyes, redness, or if you're using contact lens, is there contact lens discomfort also there? Besides the ocular symptoms, you can have neck or shoulder pain associated also due to this. So if you are having any of these symptoms, few of them or even one of them, if your answer is yes, you should be sure that you are suffering from digital eye strain or the computer vision syndrome, as it is commonly called. Now, what is this computer vision syndrome? It has three aspects: the digital screen induced ocular stress and strain, which I'll be taking up; the dry eyes, this will be taken up by our next speaker, Dr. Sumit; and the non-ocular symptoms. So we'll discuss one by one. Now, what are the etiological factors of the CVS or the computer vision syndrome? Poor lighting, glare on a digital screen, improper viewing distance, poor seating posture, uncorrected vision problems or refractive errors, effect of excess exposure to the blue light, and which is the harmful light. So just a mention of the blue light, which emanates from the computer screen and mobile devices. The blue wavelength, it is the most harmful. The computers are known to have this roughly less than 450 nanometers, but the dangerous part is also 415 to 455 nanometer. So somewhere we are at risk always when we are on the screen. And the impact of this blue light is not only in the ocular strain, it is causing not only the computer vision syndrome, it is also causing retinal problems due to the cell oxidation that is increased, and age-related macular degeneration and cataracts are also increasing. And it is not that the condition is so hopeless, because protective measures are available. We just need to follow them. Another big aspect due to the screen time is the myopia epidemic. The ophthalmology field is full of this research nowadays going on. Everywhere in ophthalmology, this is the talk of the day. Myopia increasing due to the increased online use, online screening. The myopia is basically the nearsightedness. And there has been I would say, an epidemic in the myopic. Children are just pouring out with myopic problems. The numbers are just jumping from 2 to 3 to 6, 7 because of this excessive online use. So all these researches are going, and especially this increased screen time during the coronavirus pandemic has been harmful to the kids' eyesight. And so we need to be careful. Now, what are the conclusions of the various studies on myopia? At least part of the worldwide increase in nearsightedness has to be due to these near work activities. And so online screening is responsible. Spending time outdoors, especially in early childhood, it can slow the progression of nearsightedness. And using any electronic media before the age of 2 should definitely be avoided, even if it's only for a few minutes. And we can just retrospectively think what we are doing. Children of 1 year age, they have mobiles in their hand. So this is very, very damaging. And the results are still mixed and researches are still going on. But one thing is sure shot proof, that digital screening is increasing the incidence of myopia in children. Now, how to get the relief? We should treat, once we know we can't do without the screening time, we have to be online for our classes. We have to find out certain ways. So whenever you are on screen time, before you put your child on online screening programs and all that, Just get a comprehensive eye examination of the child. Treat the underlying visual or ocular problem which he or she may be already having before the screening exposure, because then you may correlate it to the screening exposure while it was present before only. Correct any refractive error which is present, any hypermetropia, myopia, astigmatism. Presbyopia, that is for old people. If presbyopic are on the this screen, they have to have the customized computer eye glasses. And so check your viewing distance at which the child or you are comfortable before you go to the ophthalmologist or to the optometrist and get a proper glasses or refractive error corrected for yourself. Proper lighting is a must. The ambient light, it should be half as bright as we are seeing normally nowadays in our room. It should be half to that. Exterior light should be eliminated by closing drapes, shields, or shades or blinds. Interior light should also be reduced a bit, and windows should be towards the side of your monitor and rather than being in front or behind. This is helpful, we'll be discussing. Then minimize the glare. What is glare actually? Glare is the amount of light reflecting off the front and back surfaces of our glass lenses, and it is definitely a cause of eye strain. And so whenever you are, if you are using glasses, you have a refractive error, you have to have lenses which have anti-reflective coating and amber colored coating. It minimizes the glare and blocks the excess blue light. The glare causes eye strain can be also coming from the furnished surfaces or from the computer screen. And the remedial measures can be anti-glare screen on monitor, slightly darker color walls with matte finish, and cover the windows. LED and LCD screens are better. So because in this, the flicker problem is not there, especially when the refresh levels are less than 75 Hertz. And the old fashioned CRT, they have flicker problems. Okay, to screen with highest resolution should be possible. We should take screens which have the highest resolution. We should choose a relatively large display. So whenever you are attending your classes, children should prefer a desktop or preferably for laptop on the table rather than taking mobiles. They are definitely more causing more eye strains. So prefer a desktop. That's the best. Then brightness of display vis-a-vis the brightness of your surrounding place. It should be the lighting of the your screen should be equivalent to the ambient light. If it looks like a light source, it is too bright, as you see in this left side. And if it looks dull and gray, as in the right side, it may be too dark. So you have to maintain the brightness of your screen at an ambient level with the surroundings. And that is very important. That will not lead to digital eye strain. Then blink more often. This topic I'm not going into detail because Dr. Sumit will be covering it in detail. But blinking has to be there more often because it causes dry eye otherwise. Now, always remember this rule, 20-20-20 rule. Exercise your eyes. This is very important, very simple to remember, and children should remember it by heart. Always after every 20 minutes, look away from the screen. Looking away from the screen doesn't mean that you have to get up from the table, you have to go out or anything. Just remove your eyes away from the screen. You can just move here and there, your head here and there, not your whole self. Then 20 feet means gaze at a distant object. If you have a window at your side, you can gaze outside or you gaze somewhere in the room. It should be at a distance of 20 feet. Then gaze for 20 seconds. So this is the 20-20-20 rule. After every 20 minutes, look away from the screen, look at 20 feet and look for 20 seconds. And another rule that is added to is that after every 2 hours, get up from your seat and take a break for 15 minutes. So you can sit on your seat till 2 hours, but in that 2 hours, after every 20 minutes, you should follow this 20-20-20 rule. And after 2 hours, you can get up and take a break for 15 minutes. Now, whatever I've discussed are the ocular symptoms. Now, you also have non-ocular symptoms of CVS, and these are generally the neck, back, or shoulder pain. And these are generally seen when children, they lie down and take their classes, or they do not keep erect, they do not sit on the table and the chair, they do not use a proper desktop, they are very casual in their seating position. That is when constant and long classes, they lead to neck and shoulder pain. And remedial measures obviously are optimal seating arrangements with a carefully distance should be coinciding with the distance from the screen, and altering the image size to provide a more comfortable working environment. The screen and the distance should be roughly 20 to 24 inches between the screen and the person sitting. Now, there's another non-ocular symptom which is very common, especially when we are constantly using a mouse, and that is called the carpal tunnel syndrome. It is due to the pinched median nerve at wrist. It leads to numbness, tingling, and pins and needle sensation in our hands. And generally it occurs in, you are continuously on the computer for 12 hours or more, and nearly 5 times more it is seen. And for this, first of all, you reduce your screen time. Don't be continuous, follow the 20-20-20 rule, and then splint or stretches can be in improving the symptoms. So all that we can see, very important to just summarize, I would say, follow the screen time. Don't use excessively long times. 20-20-20 rule should be followed. Your position of your head and your monitor the eyes should be at the level of the upper monitor, and your screen should be roughly at this degree of 30 degree from your eyes. If you follow this, the glare and glare problems would be reduced. Then your airflow should be such that your air conditioner or dry eye is not striking your cornea and not leading to dry eye. And other ocular features like blurred eye and all these have to be taken care with visiting the ophthalmologist. Now, what is the parental role? What are the strategies which we need to rein our child's screen time? First of all, the parent should be aware of how your child spends his or her time and how much time he's spending on screen. Watch how your child reacts to screen time and notice the significant behavioral problems, if any, when you try to reduce that screen time, or you try to tell her to be away from that screen. Do they exhibit tantrums or
Nisha can take over. I think the voice is lost.
Yes, ma'am. I think we are not able to hear Dr. Urmil Chawla. Anyways, that was a very informative session from you, Dr. Urmil Chawla, and we are really thankful to you for it. We are extremely delighted to welcome our other revered guest, Dr. Sumit Sachdeva, Professor in Ophthalmology, Regional Institute of Ophthalmology, PGIMS, Rohtak. Dr. Sumit Sachdeva completed his MBBS and MD in Ophthalmology from PGIMS, Rohtak, and he has many papers to his credit in various national and international journals. And he has also contributed various chapters in ophthalmology, books of repute. He has also conducted international workshop on glaucoma in 2016. And we feel really graced by your presence, sir, and wholeheartedly thank you for sparing some precious moments from your valuable time. And now I request Dr. Sachdeva, Dr. Sumit Sachdeva, to guide everyone and continue with the eye care session.
Thank you so much, ma'am, for the kind introduction. And at the outset, I would like to thank the Scholars Rosary family for inviting me here to interact with the students and the teachers alike on a very important topic. And my work has been made all the more easier by Dr. Urmil Chawla, ma'am, because she has almost covered whole of the topic, and I would be just covering up the dry eye part of it, and hopefully I'll be doing justice to what the people want to know. So I hope my slides are visible. I'll just start with that. Yeah. Just a moment. Is it visible, ma'am?
Not yet, sir.
No, sir. Sorry.
Okay. Yeah, is it now?
Yes, now it's visible, sir.
So I would be dealing with the dry eye disease in the digital world, and most of it has been very nicely covered by ma'am, Dr. Urmil ma'am, and I'll be just going through some of the things that has already been covered, and I'll be dealing with some of the new things here. And we are dealing with another pandemic nowadays, and that pandemic is of mobile addiction. Now here, mobile doesn't mean only the mobile phone, we mean the screen time basically. And we see everywhere the people who are going or who are sitting, walking, wherever they are, we find them using their mobile phones, even while sitting during a dinner table or on a dinner. And we find the children having their mobile phones out and not talking to the parents or the siblings also. And so this is the pandemic that we are faced in addition to the COVID pandemic that has been going on. And during this COVID era, the screen time has increased tremendously, as has been pointed out by Dr. Urmil, that earlier the time was around the leisure time. It was basically the leisure time for the students who used to just play around and on the games or on the computer, and the studies were, they were more of a books they were being used. Now the screen is being used, and the screen time has gone up to around 6 to 7 hours, and that is really detrimental to the child's health. Now, no age is immune in this. We see that right from a toddler to the adult person, or everybody is on the mobile phone at some time or the other. And the most dangerous would be the one on the left side, on your left side, the toddler, who is just started on his journey of life, and he's on a mobile phone. So we have to prevent that, and this thing is creating lots of problems. What are the gadgets that we are using nowadays? We have TVs were always there. Now the mobiles, computers, and the game consoles are there. So we have to look into all these things, all these screens. They just emit out the blue light, which is really harmful for the eyes. And we have to take care to prevent our eyes from these blue rays. There has been a study in an Asian country like us, in South Korea, that they studied that what is the prevalence of the problem statement of dry eye amongst school children. And they found that around 4% of the children from 1st to 3rd standard had dry eye disease. And about 9% of the children from 4th to 6th standard had dry eye disease. Now this 9% and 4% dry eye disease means that these are the children who required treatment for this. They were not that they had some symptoms off and on and were relieved by the simple exercises or not looking at the computers for some time. But these were actual problems which had to be treated by an ophthalmologist. So, and children above these classes, like more than 6th standard or higher, and they had even more incidence of dry eye. This was because of the excessive use of mobile phones during their studies or during their playtime. So this is quite alarming. Means 9 out of every 100 children have a dry eye disease. That is quite alarming for us. So what are the problem associations? Why this problem occurs? I would rate them in 3 P's. Like, one is posture. Your posture is wrong while studying, while on a computer. Second, your period of screen time. That is the most important part. That the period of time that you are spending on a screen is directly proportional to the amount of dryness in the eye that you have. And what is the process of recovery? How much time do you take to recover or break from the screen? And how much time do you spend away from the screen? That is also very important. So these 3 P's are very important in a person who is suffering from dry eye disease. So a computer vision syndrome, also known as digital eye strain, mostly it happens in people who have a screen time of more than 2 hours, a continuous screen time of more than 2 hours, and excessively bright screen or a low or insufficient light also causes similar problems. What are the symptoms? Now, symptoms, we all know that dry, gritty feeling in the eyes, eye fatigue, headaches and double vision, constant rubbing and tearing, red and congested eyes. These are the symptoms that are there, and that we feel the children also. We get numerous complaints every day on phones, on some of the parents just complain to us that my child is having red eyes, red congested, gritty eyes, and he's complaining of eye fatigue. So what should we do about it? So this is all due to the increased screen time that the children are having nowadays. And you can see the image on your right. The child has a typical picture of a of a dry eye, like a dry, and these people are prone to allergic eye diseases also. So you have eye fatigue, itchy eyes, dryness, blurred vision, double vision, headaches. So these are the complaints, basic complaints of the children. And what are the additional effects? Additional is neck pain, rigidity, finger and joint pains. Carpal tunnel syndrome has been covered by Dr. Urmil. Low back aches because of the bad posture, brow aches, insomnia. Insomnia is lack of sleep. Longer the time you spend on the computer or a screen, the lesser time you get for the sleep, and you don't fall asleep as quickly or as easily as you used to. So this is very important cause of an insomnia in children. So what should we do about it? What can we do? First and foremost is to limit the screen time. The screen time should be limited with frequent breaks, and the leisure time, especially nowadays, like in this COVID era, when we have an increased screen time due to the classes going on, it has to be curtailed. The leisure time, I would say, should not be more than 45 minutes to 1 hour. And the screen time, well, that depends upon the school, that how much time the child spends on the computer. And it is important for the teachers also to make their lectures such that they have frequent breaks in between. Like a lecture should not be more than half an hour, because as the 20-20-20 rule says that after every 20 minutes, you need to take a break. So that 20 minutes can be extended to 30 minutes, but a lecture should be around that 30 minutes mark. And yes, blink constantly. Blinking is very important. And 20-20-20 rule has already been covered by Dr. Urmil. You have to take a break after every 20 minutes for 20 seconds. And in those 20 seconds, you have to look at a distance of 20 feet or more. Better is to look outside a window and see at a distance. That will relax your eye muscles and the fatigue will be gone. Certain eye exercises are recommended. And the foremost would be the palming exercise. Very important and very easy to do. Just rub both your hands, feel them warm, place them over your eyes. It relaxes the eye muscles and relieves fatigue. This is how it is done. Just rub your eyes, rub your hands, put it over your eyes, and apply it for around 15 to 20 seconds. That would be okay. And you can repeat it for 3 to 5 times in a day. That helps a lot. Then constant blinking. You just have to, because during constant viewing of your screen, the blinking goes down. The blinking goes down, and the blinking, what the lids do is they just spread the tear film over the cornea and prevent it from drying. Now, when blinking goes down, the dryness occurs because the spreading of tears is not happening. So you have to constantly try to blink when you are taking a rest, or also in between, try to blink your eyes. Then eye rotation. Just move your eyes on top, right, left, bottom, everywhere. Just try to rotate your eyes so that the eye muscles are exercised. You are not fixing at one particular point. You are just moving your eyes so that the muscles get in. They are not fatigued. They are just not fixed at one point. And correct your posture. Don't slouch. As ma'am, your yoga teacher has also pointed out, your posture is very important. Sit with an erect back. You can see on your right side, this is the ideal posture. Your computer screen should be around 1.5 to 2 feet from your eye level. It should be slightly lower, 1.5 to 2 inches lower than your eye level. And your back, your spine should be erect. Your thighs should be straight, parallel to the floor. And in this posture, you'll have a maximum benefit because your back and the neck muscles are properly supported by your body, and then they will not feel fatigue. So this is the wrong posture on the left side of the child, and on the right side you can see that he is having a right posture and studying rightly. So this is how the child should sit on a desk and not slouch over it. Proper lighting, as ma'am has said, that yes, ambient lighting is very important. It should not be too bright, it should not be too dark, and windows should be on the side, not directly in front or the back of the computer. Use drapes and curtains to just block out extra light. Use table lamp, or computer screen brightness should be adjusted according to the ambient light of the room. Some stretching exercise while sitting down are very important for the children. You can just do this whenever you take a break, like every 2 hours. When you take a break, just stretch your arms out, you stretch your arm up, and you do your neck exercises. Just rotate your neck so that the muscles are not fatigued. Then the role of the parents is very important. They have to ensure that the screen time is less. There is a proper and balanced diet for the child. High protein diet is recommended, and encourage the child to exercise. Always ask the child to go out for some time in the lawn or outside just to have a feel of the fresh air, not sitting in the room throughout the day. And be aware of your child's problem. If he says that he is having headache, he is having some blurring of the vision or double vision, don't ignore it. Always consult an ophthalmologist for that. So if you have any of these things, dry itchy eyes, watery eyes, tired eyes, headache, blurred vision, neck and back pain, so you might be at risk of digital eye strain. You have to consult your doctor. Do not start the medications on your own. Get a full eye checkup, use prescribed therapy fully, and do not forget to follow up. Just because you're feeling okay doesn't mean that everything is all right. You have to go there, get a follow-up, and then stop the treatment when your doctor says so. The lubricant eye drops are very good for dry eyes, and they are to be used only by the persons who are actually suffering from dry eye, and it has to be decided by the ophthalmologist. Do not use them on your own. They have to be used under medical supervision only. And preservative-free eye drops are preferred, and do not use steroids at any time unless indicated by your doctor. So what would be the carry home message? From my side, it would be use digital screens judiciously, leisure time on screens to be curtailed by the students, take frequent breaks, regular eye checkups, lubricants as advised, and exercise. Be safe, stay home. Thank you so much. And if there are any queries, I would be glad to take them. Thank you.
Thank you so much, Dr. Sachdeva. And this session was actually very benefiting for everyone present here. And now Dr. Urmil had disconnected. Now she has joined us back. So now we carry on with the question answer session. And students can ask their question from Dr. Urmil as well. So I would welcome back, ma'am.
Yeah,
and
sorry, there was some problem. I don't know.
No issues, ma'am, no issues. I would like now the students to take up their questions. Can we unmute them one by one?
Yeah, please go ahead.
Okay. I think Pragya Dua is there. Yes, Pragya, you can take your question.
Good evening, ma'am.
Good evening, Beta.
Ma'am, my question to you is that while a child uses a computer, how important is the brightness of the screen and the room?
See, it's the way I told you in my presentation also, the brightness is definitely important. And you just do a test. You just see with the ambient light, whether it is compared with the working surrounding, it should be at level with the ambient light. And the ambient light should be in a room should be half of the normally we are having nowadays. So it should neither be very bright nor dim, because in both the cases, eye strain is bound to occur. So remember that you have to keep the brightness in such a way that it is exactly in correlation with the surrounding light. Both the things are going to trouble you, the brightness as well as the very dim light.
Oh, thank you.
Dr. Chawla, next question is coming from Saloni Narwal.
Yes.
Good evening, ma'am.
Yeah.
Ma'am, my question is how effective are the anti-glare glasses? Also, do we need to consult the doctor before using them, or anyone can use them?
See, anti-glare glasses, the purpose is to cut the reflection and glare from the bright light. And this bright light again causes all the symptoms of computer vision syndrome. So these anti-glare glasses are very important. Nowadays, we have a computer screen with anti-glare screens, and the purpose is to prevent. Another thing which anti-glare helps us is that whenever you have anti-glare, you do not have to keep changing your head position to make yourself comfortable. Otherwise, that glare makes you uncomfortable, and you have to keep either changing your laptop screen, or you have to change your own, you have to squint your eye, or you have to change your posture in such a way that it becomes comfortable for you. And this again leads to various eye strain problem, and it's definitely not comfortable. The second out of the way use of these anti-glare screens is that they protect the computer screen from scratches. They keep them scratchless. They are non-adhesive, so you can remove them and they can be used. And they are, and about the anti-glare glasses, they are also important, but definitely when you have symptoms of glare, just don't use them routinely. But definitely when you feel symptoms and when you are too long on a screen, you should be using those anti-glare screens glasses.
Okay, ma'am. Thank you, ma'am, for telling that.
Next question, ma'am, is from Gauransh Arora.
Good evening, ma'am.
Good evening.
My question is that can common vision problems be inherited?
Yes, there are certain common vision. You can take myopia itself. It's a common vision refractive error, and it has been seen. Genetic counseling has proved that it runs in families. So whenever a child has very high myopia, we should get a genetic counseling, and that parents should be careful that when the child gets elder, he should not get married to another myopic person. So symptoms like myopia, they definitely run in family, and that's one of the most common refractive error. Though this digital screening has increased myopia, but genetics definitely plays a role in this. So genetic counseling has its role, and definitely when children come with high myopic numbers, we always ask them कि आपके घर में किसी और को तो नहीं है. So we generally ask them, and generally it is found that their parents or grandparents, someone or the other is having in a link, and that goes on in the family. Especially the very high myopic errors, roughly 17, 18, 20. This diameter of errors are generally commonly seen running in the family. Even dry eye has been found to have some role genetically, not too much, but yes, it has been seen to be running in families, because certain autoimmune diseases and certain syndromes, they are known to lead to dry eye, and these autoimmune syndromes, they run in families. So genetics always has some or the other role in few eye errors.
Thank you, ma'am.
Dr. Saab, next question is coming from Ishnur.
Yes, please.
Good evening, ma'am.
Good evening.
Ma'am, my question is that how frequent we should wash our eyes? We should use warm water or cold water? And is the water from borewell harmful for our eyes?
See, there's a very wrong misconception that you should continuously keep washing your eyes daily. The olden people, they say कि आप दिन में 3-4 बार मारो. I would say this is a wrong thing, because an eye normally has a conjunctival flora. That is a normal conjunctival flora, which is having its defense mechanisms. The microorganisms which are present normally, which help us prevent infection, and also the normal immune mechanisms are present in the conjunctival flora. And if you continuously keep washing your eyes 4 or 5 times, that conjunctival flora gets washed away. So it is always advisable once in the morning, that too if you feel very comfortable, you get relieved after giving a lot of these chapke, jisko kehte hain Hindi mein. So if you are comfortable once in the morning and maybe once at the evening, but don't make it a habit every 2-3 hours. Some people have a habit to just clean their eyes, and they normally don't clean it gently. They just go ahead with violent washes like this. And so that is definitely not good enough. So you should not have them. Once a day is more than sufficient. And then yes, definitely these borewell waters are not advisable to be used for eye wash. Better to use distilled or the better hygienic water that is necessary. That would be helpful.
Thank you, ma'am.
Next question is for Dr. Sumit Sachdeva. Priyanka Sharma would like to ask that question.
Good evening, sir.
Good evening.
Sir, I would like to ask the daily practices we should adopt to keep our eyes healthy.
Daily practices, as I have already told you, that you should first of all limit your screen time. Go out, look at the distance, try palming exercises, try the rolling exercises that I told you. And yes, whenever you are tired, whenever you are fatigued, don't just go there and start watching TV or screen or something else. Just lie down for some time, close your eyes, let them relax, and then when you are better, then you can do. And pencil, the pencil exercises that you were told during your younger days also, that you have to pencil nose exercise. Just take a pencil, look at the tip, bring it to your nose, just see that the tip is, it's not blurred. So you can do that exercise also, so that the muscles are relaxed and muscles are actually not weak.
Thank you, sir.
Just a second, I'll just interrupt one thing. Please remember about your diet. Green leafy vegetables, the cod liver oil in fishes, all these things are very important. The citrus fruits, these are very, please, the children should nowadays realize that the stress they put, I think they take junk foods, lot of it. And this junk food is really not at all healthy. So green leafy vegetable, I would say papaya, vitamin A things are very important. Citrus fruit, cod liver oil, protein, egg, nuts, cheese. Please try to stress on these. These are definitely, they have a role in your healthy eye practices.
Next question is from Arshia to Dr. Sachdeva.
Good evening, sir.
Good evening.
I had an eye inflammation. So I would like to ask that how can I prevent it naturally? For instance, what are the home remedies to cure an eye inflammation?
Can you ask again, Peter? Can you speak louder? I'm not able to hear you.
Sir, I had an eye inflammation.
Okay.
So I would like to ask that how can I prevent it naturally? For instance, what are the home remedies to cure an eye inflammation?
Eye inflammation?
Yes.
You're saying the eye problem. That means the eye infection you are talking about.
Yes, sir, the redness and the pain in eyes.
Okay, that's good. So eye inflammation, the causes are many. Most important one is the conjunctivitis that we see every season. Like in the summer season, we see lots of people coming up with red eyes, discharge in the eyes, and sticky eyes. So these are the conditions. These are due to the various bacteria and viruses that are present during that period. And the other aspect would be the allergic conditions because of the dry season, the pollen season when the harvesting is going on. Then the people come with with the itchy eyes, red eyes, and watering. So to prevent that, first of all, you have to identify that what kind of red eye are you having? Is it with sticky discharge or is it with watery discharge? Because watery discharge is mostly allergic, while the sticky discharge is mostly due to the infection. And then if there is an infection, antibiotics have to be given and they are to be prescribed by your ophthalmologist. The allergic conditions also have to be treated by the ophthalmologist, but that you can prevent because when you know that this season is harmful for my eyes, I'll prevent myself from going out without any protection. Like if you are going out, you use your goggles, your spectacles, whatever you want to wear, so that direct allergen it doesn't affect your eye. And yes, as ma'am has pointed out, you need not go and wash your eyes that frequently, but yes, washing does help because that whatever the pollution, when you go out and come back, you have different pollutants that have affected your eye. You can just wash them off gently and then move on. So this is how the home remedies are like this. You don't have to do something very special, but yes, you have to keep your eyes clean. The eyelashes, in fact, should be very clean because eyelashes, if they're infected, then they can lead on to recurrent problem of styes or chalazion, whatever. So we have to clean the eyelashes also during your these period.
Thank you.
So next question is from Gundhal.
Good evening, sir.
Good evening.
So my question to you is, in this phase of COVID, some companies have come with UV light boxes that kill virus. As they claim, is UV light dangerous for human eye?
Yes, I would say a constant looking at the UV light is quite dangerous to the eye. If the UV filter or UV box is being used, you need not look at it. You just move. You just keep the things that you need to sterilize in that box, and then move out. It has not to be looked at for a longer period of time because otherwise there are UV radiations can cause retinal damage.
Thank you, sir. Next question, Varishtha would like to ask.
Good evening, sir.
Good
So
evening.
what should be the frequency? So what should be the frequency to visit an ophthalmologist or optometrist for someone is already using glasses or lens and should go to optometrist directly or by recommendation of doctor?
A very nice question. Because see, what we advise is that every child should get an eye checkup at least once a year. So if you have no problems also, then also you should get your eyes checked at least once a year. But if you have problems, then that depends upon the severity of your problem. If you are suffering from allergic conjunctivitis, suppose, and you need to go frequently, that means he might be calling you every 2 weeks, every 4 weeks, or every 2 months. So you have to go there according to your ophthalmologist's advice. And if just for a refractive error checkup, then every 6 months would be okay. If you are suffering from any myopia or hypermetropia, whatever the condition, refractive condition that you are suffering from, then you can get it done every 6 months also if the numbers are changing constantly. If your number has become stable, then yes, after 1 year also you can get it checked. So at least once a year, a child should be checked.
Next, we have one parent among us, Miss Sanjali Gupta. She would like to ask a question from you.
Yeah.
My question is, are there lifestyle changes I can make to reduce or prevent the risk of my eye disease?
Yeah, good evening, ma'am. The lifestyle changes that we promote are basically the diet and the exercises that we ask you to do. Because other than the medications, these are the best things that you can do to prevent your eye diseases. The lifestyle changes would be that exercise regularly, walk outside in your lawn or away. That is not, you should not go to a crowded place nowadays, but at least you can go out, have a walk or exercise, whatever you can do easily. And secondly, your diet. Your diet should be good. Like ma'am has said, that your green leafy vegetables, the fruits, the vegetables, a balanced diet helps goes a long way in helping you avoiding your eye problems. So that is what I would say. And the persons, I think, because I'm being a glaucoma specialist, I would say that people who are on glaucoma medication or who are at risk of developing glaucoma, they should not wear tight neckties or tight clothes that close the upper button of their shirt or t-shirt. They should not do that. The neck should be relaxed because the pressure then transmits to the eye. Smoking has to be stopped. Yeah, that is very important. Smoking is one thing that it is very, very harmful for the eye. So I would say that if one thing that a person needs to do to avoid eye diseases, he has to quit smoking if he's a smoker.
Also diabetes, I think.
Diabetes is controlled by exercises and all. Yeah. If they are.
One has to be very careful.
Yeah.
Thank you so much, sir. I think that is all with the questions we have. And it was actually a very informative session from you, Dr. Sachdeva, and from you, Dr. Chawla. Thank you so much. And now I would request respected principal ma'am to present the concluding remarks and express gratitude to our revered guests.
Dear viewers of today's session, your health is our concern. This is the objective of our Wellness Week, and hope we are able to reach to you all as students and their families. As you all know, these are testing times and completely unpredictable at present. As far as eyesight is concerned, it is very vital that we pay proper attention and take complete daily care while we are exposed to screen with the increased time. As most of us are working from home and on screen, I'm grateful to both the eminent doctors from the city who are our school parent also, and I'm so glad that both of you gave us precious guidelines and an insight on the eye care, which will be very beneficial to our students and parents. I express my hearty gratitude to you. I also am grateful to the yoga teacher, Miss Claire, for conducting the wonderful yoga session for the right postures. Dear all, our eyesight and posture, they have a great link, as you have learned in today's session. We need to maintain both of them simultaneously to protect our eyes. So when we sum up this session, the three vital points to remember is, when we go through this unpredictable time of coronavirus, what we can do to prevent our eyesight from spoiling. That is, number one is that we should take care of the posture, of course, when we are taking online classes. And number two is that we should shift our entertainment time, that is to the off screen, that we should concentrate more on the board games and physical activities while we are heading for some entertainment, and we should not use screen at that time. And number three is our complete healthy diet. And we will be heading forward for our more sessions in this week, which will be focusing on the good nutrition, psychotherapy, and developing good constructive habits to bring about the change in our lifestyle and be strong in our immunity and maintain the good health. Wish you all a happy, healthy times, and see you tomorrow at the same time. Thank you.
Thank you so much, ma'am.
Now we can head for the national anthem. And we'll